most people who don't breastfeed long enough tend to suck when they swallow. About 90% of the population suck when they swallow, and I think that is due to insufficient breastfeeding. But the answer is that if the tongue is not on the palate, the back of the tongue drops like that. You understand? If this is the palate, the tongue will be like that on the palate. If the patient does not hold their tongue up, it will drop down. But the root of the tongue is in the hyoid bone. So if you push your tongue on your palate, you have to contract and lift your hyoid bone. The tongue acts as a valve. It can either cut off the nose, the mouth, or the pharynx. The tongue can adopt those three positions. If it is on the palate, then good. You will have forward growth and a good occlusion. If your tongue drops a little bit down, you may have malocclusion, but most of all, your mandible will not grow forward. Therefore, if the tongue is not on the palate, the whole face will drop down and back. Those patients have sleep apnea. But the reason they have sleep apnea is not because the mandible is back, it is because the tongue is back. If I have a patient who comes to me, is there someone in the room who has problems with sleep apnea? No? None of you?
None that we know of.
A little? Yes. Well, if you have problems with sleep apnea, I will say to you, sit up straight, close your lips, and breathe through your nose, deep breath. You are okay? Not okay. Then you will need your mandible widening so you have good airway. And that is the first most important thing. If you then widen the maxilla, then that is okay, but you will have to keep your tongue on your palate or the maxilla will collapse again. Now put your tongue on your palate, and now when you breathe, can you breathe okay?
Yes.
Perhaps yes or no?
It is. Yes.
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 Well, in which case, then the reason you have sleep apnea is because your tongue drops from your palate.
Somebody else, I don't have it. She does not have it. It's somebody else.
Oh. Stand up straight. Can you breathe through your nose? If yes, I will say, well, put your tongue on your palate and hold it there all night. Now, many people find that difficult, but if you give them a stage 3, they will learn to keep their tongue on their palate because they have to keep their mouth shut all night. So the simple solution to sleep apnea is keep your tongue on the palate. If you have difficulty, then a stage 3 will teach you to keep your tongue on your palate. But don't visit a surgeon. Any surgeon can cut a bigger hole. That is what the surgeons do. They cut a bigger hole and say, yippee, I have cured you. But do you know the relapse rate for surgery?